Hi, thank you so much for joining us during today's live broadcast. Today we're going to be talking about how picky eating affects kids and what parents need to know. My name is Corey Johnson. I work on the social media team here at Children's Hospital of Wisconsin, and today I'm joined by Dr. Praveen Goday. He is a pediatric gastroenterologist and the director of our feeding team. Now, for today's discussion to work, we really want your participation. So please go ahead and post your questions in the comments section of this video, and we will try to answer as many questions as we can during our live broadcast. Now, I know a lot of kids and parents are affected by picky eating, and sometimes as parents we blame ourselves. But is that fair, and should we be doing that? And what should we know to really help our kids who are picky eaters? Well, that's what we're going to be talking about today during our live broadcast. But before we get started, I just want to introduce you to Dr. Praveen Goday. Dr. Goday, could you describe a little bit about yourself and the types of patients you see?
Like you said, I am a pediatric gastroenterologist. But for the purposes of this broadcast, I'm going to talk about my role as the director of the feeding team. We see children with difficulties with feeding and eating more than just picky eaters. We also see children who have tubes, they are fed through gastrostomy tubes because they cannot eat, and we try and help those children eat. So those are the kinds of children that we see in the feeding team, and not just picky eaters.
Great. And then, so how normal is it for a parent to have a picky eater? I'm a parent myself. I've got 2 kids, and sometimes I feel like I'm always serving peanut butter and jelly sandwiches. Is this normal, or?
So I think as a parent, every single parent feels like at some point their children are picky, and this is almost a normal phase of development, and it is important to handle it correctly to prevent it from becoming a bigger problem.
And is there a point at which a parent should be worried, or are there things that a parent should be looking for to know that maybe we're getting to the point where I should change what I'm doing?
So the first thing is to make sure that your child is growing okay. So children that are growing okay are less likely to have a problem. The second thing is your child should be eating from all of the food groups. And for those of you that don't remember the food groups, you have to think about grains, things like rice and wheat. You have to think of fruits, vegetables, and then milk and other dairy products. And finally, protein. Protein for most people is some form of meat or fish. And for vegetarians is lentils and those kinds of things. So if your child is eating from each of these groups, it's less likely to be problematic. The other thing that we see, which is not very common out in the community, is the fact that the child is still stuck on certain textures, which means it's normal for a 6, 7, 8, 9-month-old to be eating baby food, but when a 1.5-year-old cannot really eat real food and still has to be on baby food, that's a problem, and for that you need to seek medical attention.
And so when you talk about textures, do you mean like rice tastes a certain way in your mouth, or peanut butter, or bread, things that are crunchy and soft, or wet or dry?
Right. When you think about a baby starts out with breast milk or formula, and then gradually advances to the point where he or she is eating adult food. In between, we have these pureed kinds of foods, the so-called stage 1, stage 2, and stage 3, or if you make them at home, you make them progressively lumpy. So some babies are unable to move from the complete puree to what would be a regular food, which is, a piece of bread, a piece of meat, stuff like that. And that can be a problem. So that's what I mean by textures.
And so it sounds like there might be, as a child develops, at different phases, different types of things that parents need to be aware of, right?
Correct. And it's something that we do somewhat naturally. We start out a baby on very, very pureed food, and then gradually make it more and more lumpy, and then the baby starts eating table food, and then off they go. So most babies are able to do this, but a few kids have problems, and those are the kids that we need to see.
So I'm going to get to the question that I know my wife and I talk about all the time, is if I put food on the dinner table in front of my child, and he says no, what should I do?
So the first thing is you have to be a good role model. If you don't eat broccoli, it's very unlikely that your child will eat broccoli. The second thing is to prevent grazing. By grazing, we mean having the child eat and drink all day long, and so that they're not hungry for the next meal that's coming up. The third thing is it is your job to put what is developmentally appropriate in front of a child and have him or her eat it. You know, you put a small amount of a protein, you put a small amount of a grain, you put a small amount of a fruit or vegetable, and then give them a beverage, which is usually happens to be milk. You don't want to give them a meal that has everything that's foreign to them. So something has to be familiar, and you can add a few unfamiliar things. So the problem happens when the child says no. Then you have to decide how you're going to deal with that. You have to offer a reward, which is like maybe you clap if they take a bite. You do not want to offer them dessert necessarily. That can occasionally be a reward.
Yeah.
You never want to offer them a bribe, which is give them something before they eat that piece. That's a bribe. Whereas a reward is after they take the bite. And it does not need to be dessert. Little children are very happy when you clap and create a big fuss saying, hey, you ate your first piece of broccoli. So the other thing is you do not want to punish them for not eating their food, but at the same time, at times it's okay for the kid to go to bed hungry. And that's something that you have to be prepared to do. And if you're not, then what happens is they come to know that if I don't eat my broccoli, I'm going to get ice cream later, and that's a bad situation to be in.
And for those of you, again, joining us on Facebook, please go ahead and post your questions in the comments section of this video, and Dr. Goday and I will try to address as many of them as we can. So one thing I know my wife and I talk a lot about is just introducing new foods. I know you talked a little bit about that. Is it harder to introduce new foods to kids who may already have preferences in their taste, that may be a little older, like 5, 6, 7 years old? And at what point in time can you really start to give a wide variety of foods to a young child?
So the earlier the better. As with most things, if you are dealing with 5, 7, 8-year-olds and then you're trying to do it with a teenager, you're not going to be very successful. So toddlers have you're going to have the best success with toddlers, and you want to start early. Like I said before, you want to use some familiar foods and some unfamiliar foods, and get them small amounts. The final thing is toddlers are very well known for food jags, which means they will eat the same food for 2 weeks and then will not eat it for a couple of months, and that's okay. That's a normal developmental thing. The other important thing is you might have to present a food 20 times to a toddler before he or she accepts it.
So hold on, I have a 4-year-old and a 2-year-old, so you're saying I should introduce food 20 times and expect my child to say no 20 times?
Absolutely. So I'm picking on broccoli.
Yeah.
I like broccoli, but some people don't. Let's pick broccoli again. But you might have to introduce it 20 times before the child says yes.
So the amount of patience I have to have as a parent is pretty important in the success of introducing
Absolutely.
foods.
Nobody told you that parenting was going to be easy and without patience. So there you go.
All right. It looks like we might have some questions from our Facebook fans.
So Amy posted that she has a 2-year-old son who won't eat any vegetables, and the only meat he eats is chicken nuggets. They try often, but even when he takes a couple bites, it's very little. He's also underweight. What other suggestions might you have in introducing new meats and proteins?
So this can be a little bit difficult, and these are the kinds of children that I might actually prefer to see, especially when their diets are very, very restrictive. We need to make sure that there are no other issues such as actually problems with swallowing, though I don't believe that Amy's child has a problem with swallowing. And we might need to work through a few things to figure it out. But basically, in general, repeat offering all the time. The next thing is don't allow your child to graze, and try and keep meal times as pleasant as possible, and try and see somebody. That's what I would recommend to Amy.
And when you say grazing, just you mentioned that before, you mean like don't have them just be eating crackers all day long?
Absolutely. So grazing means roughly 3-hour intervals between meals. When there's eating going on, it has to only be eating, and when there's no eating going on, there's no eating going on. So you don't leave Cheerios or crackers or chips sitting outside, or a bottle of juice, or a bottle of milk too. Some kids will fill up on milk throughout the day and then will not eat their meals. So you want to make sure that you sit them in a place and let them eat by themselves.
Okay.
It looks like talking about introducing meats, there's a couple of other families talking about that right now. What are some other strategies that you have or other options for proteins other than meats for kids that maybe don't like meat?
So number one is you want to make sure that they get enough dairy protein, enough but not too much. Typically for the toddler, it's 2 to 3 glasses of milk or its equivalent. You can substitute some of the glasses of milk for cheese or yogurt and things like that. When you're thinking about non-meat proteins, eggs are definitely a good option. The other is things such as peanut butter. So those are the nuts in various shapes or forms. The problem with nuts by themselves in very young children under the age of 3 or 4 is that they are a choking hazard. And peanut butter too can be a choking hazard if presented as a glob, but if you spread it out on a cracker or spread it out on a piece of toast, then that's not really a choking hazard. The other choice is the various lentils, chickpeas, beans, those kinds of things tend to be good proteins. And you just smush them down for little kids so that they are not choking hazards.
And again, if you're following us on Facebook right now, please go ahead and post your questions in the comments section of this video. It looks like we have another question.
Rebecca asked a great question about what can you do with babies when you're starting to introduce baby food to get them started on a good foot?
Well, we have become sort of accustomed to starting with rice cereal, and that seems like a good place to start. And rice is very low in allergenicity, which means babies are not usually allergic to rice. If you can mix it with a little bit of breast milk or a little bit of formula, that usually tends to be the first food. Once the baby's tolerated that, the general recommendation is that you introduce about 1 food a week. And you can start with fruits and vegetables, but there's no reason that you can't do meats and high protein stuff too. These rules are a little bit different if there's a very strong family history of allergy, but other than that, most other people can follow these rules. After a while, introducing a food a week means it'll take you 2 years to go through all foods. So parents at some point just give up and start introducing foods more often. But you need to follow the once a week rule if you have a child that seems to be allergic to some foods. So that's what I would suggest when you start out.
I have a question for you. So if a parent is experiencing some difficulties maybe with feeding their child, how does that relationship work between their pediatrician and ultimately maybe seeing a specialist?
I think the pediatrician should be able to handle many of the normal developmental concerns that a parent might have. And most picky eaters should just be seen by their pediatricians if there is a concern. It is only when the pediatrician finds that he or she is not able to manage it or requires additional help that they are sent to a pediatric gastroenterologist like me. I don't typically see picky eaters in my clinic.
Okay. And I hear a lot of people, even my own parents, describe, spoiling your appetite, right? And so maybe that idea that they have maybe some juice or a fruit drink or a soda beforehand, is that really true? Can you spoil a child's appetite by doing something ahead of dinner time?
Absolutely. Like, suppose I gave you a can of Coke, right, before you decided to have your meal. Your meal is going to be less well tolerated by your stomach. Mm-hmm. So that's absolutely true. It is good. This goes into the grazing phenomenon again. Mm-hmm. It's best to have very strict meal times, and this, if possible, should be followed by the entire family. It's very hard for a toddler to see somebody else eating and not want to eat off their plate. So if you can get the entire family on the same routine, it is very difficult in our, chaotic lives, but that's something that you should do for more than one reason. Having dinner together as a family is a great time to get together and talk about things as well.
And as a parent, being a role model, we would also not want to be grazing and
absolutely.
Drinking soda and all these things before
Yes.
dinner time, because our children are going to see that and think that's acceptable behavior. And,
Yes,
right?
yes,
Okay.
absolutely.
Do we have any more questions from our Facebook fans?
Yeah, it looks like Kathy asked a question about, is there any good book or resource that you have, Dr. Goday, for parents and grandparents about picky eating that they could use as a resource at home?
So the general resource is from the AAP, or the American Academy of Pediatrics, and that is taking care of your child from the ages of birth to 5 is a good resource. There's one other book that I will post as a response to your question later. It's just been re-edited, so I do not believe I do not believe I have the latest edition, so I will let you know.